Hello and welcome to Medcurity Live. I am Joe Gellatly, and today we are going to take a look at healthcare headlines. So something we preach here at Medcurity is continuous education, staying current on what's happening in our world and in our market, so you know those new risks and opportunities and how to best position your organization. So with that in mind, our fantastic producer Jordan is going to read off just some recent headlines, and we'll talk about any key takeaways. What should we be learning as healthcare organizations? What should we be applying from what's happening in the news and in our world today? So Jordan, if you want to start us off on our first healthcare headlines episode.
All right, so the first one we got is AAFP, submit 2019 MIPS data early to avoid Help Center backlog.
Help Center backlog. So American Academy of Family Physicians, MACRA MIPS, if you are participating in that program, which 98% of the eligible physicians, so over 900,000 physicians are participating in this quality payment program called MACRA MIPS. And this is the time of year you need to submit last year's data. And I believe CMS is saying, please don't call us all at once. If there's 900,000 of you, start submitting that data. And really, for the sake of everybody who's participating in this, we have a lot to do for this year. So you want to just wrap up last year. We're talking about a 9% penalty if you don't successfully participate this year in MIPS against your Medicare payments. And then next year, they're rolling out MIPS Value Pathways, or MVP, because we need more acronyms of our acronyms. But MIPS Value Pathways will once again change the process of the quality payment program, adds more requirements, but they're doing a nice job of simplifying and streamlining some pieces of that. So we've got other things to prepare for. So get that data submitted, and that's probably the key takeaway here. Wrap up what you're doing for last year, start preparing for 2020 with MACRA MIPS. What's next?
How about this one from Healthcare IT News, coronavirus outbreak used by hackers to spread malware.
Yeah, so we did talk about that just briefly last week. We are seeing emails that are using coronavirus as the hook and tricking people into opening potentially compromising links or downloading malware. So they're now literally sending you emails titled virus and attaching the virus. So watch out for that. So we've seen a couple. We've seen some say coronavirus conspiracy, and there's a link to go learn about this cure that they're hiding from us. And then it takes you out to a site that downloads, again, malware on your device. Also, we've seen emails from the World Health Organization that look like official coronavirus updates, but then install a keylogger through an attachment. So a keylogger, then you may not even notice that happens, you or your staff. It is placed on your device and it monitors every keystroke. And so it exposes you to, of course, having your credentials and passwords stolen at that point. So I would say key takeaway from that is keep your education to your team current and let them know about these new threats that are occurring, and let's stay prepared as the other side continues to evolve their attacks against us. Next headline.
Health IT Security, West Georgia ambulance pays $65,000 OCR settlement for HIPAA violations.
Yeah, so an ambulance company had their laptop fall off the back of an ambulance, and then a series of events after that. So they had to report that laptop as a breach because it was not encrypted. So the data on it was exposed. We don't know if anybody picked up that laptop, if they wiped it out, used it themselves, or they threw it in a dumpster. But because of the potential exposure, they were fined $65,000. What's interesting in that is that beyond the penalty, they were given a corrective action plan. And this is a wake-up call to anybody who's not doing any pieces of what the HIPAA guidance or HIPAA security rule requires, because they were told you have 30 days to encrypt all your devices. You have 30 days for a full plan for your security risk analysis. You have 60 days to get contracts in place with all your vendors. So you need to report back to the feds every business associate you have and show a copy of the agreement you have with them. You have 90 days to get all your policies and procedures in place. And in every piece of this, you're reporting back to the feds, and then you're on this annual and biannual interval where you need to continue to keep them updated. So that corrective action plan is very prescriptive, and I would say somewhat painful if you're not doing any of that. So key takeaway for that would be do what you need to do before you're being forced to, but also encrypt your mobile devices, especially if your workforce is mobile. That's what I take from that. Next headline.
Another one from Health IT Security, malware destroys data of 30,000 founder and orthopedic patients.
Thank you, Health IT Security, for the headlines. So this is an ortho group that had malware installed locally that actually destroyed patient information. And from what we could learn, nothing was even taken away, potentially not even viewed. It was solely a destructive piece of code that wiped out patient information. And this is kind of scary. There's quite a bit of conversation around this in our environment where people are saying, okay, so they're not even just out to get money from us. This was simply a destructive malware incident. And we saw actually a couple groups close when they had last year when they had patient information destroyed. So it sounds like the group is going to be able to survive this. And I would say a key takeaway here is test your backups. If you have good backups that you can restore after an event like this, all the patient information is there. But that requires ongoing monitoring, test and document that you're testing your backup process. Next headline, something positive.
This one's from Becker's Hospital Review. Texas Health System alerts 66,000 patients of a phishing scheme.
How's that positive? I told you to stay up and down. Okay, so how many? 60,000 patients?
66, yeah.
66,000. This Texas system, several of the employees fell for a phishing attack once again. And in this case, the objective was to redirect direct deposit. So it was actually a financial attack, but because they were in the system and potentially could have viewed patient information, the health system had to report to those 66,000 that your information may have been compromised, and it has to follow the entire breach protocol. So that was kind of interesting, but the takeaway is, yet again, do those phishing exercises, something Medcurity can help with if you don't have a process in place, but make sure your employees are sufficiently paranoid of emails that are coming in and continually educate them that this is an ongoing threat. One more headline.
All right, GeekWire. Amazon launches an on-demand virtual healthcare service for Seattle area employees.
Yeah, so Amazon launched Amazon Care this week. They actually announced it several months ago. This is for their employees, and from an app, their employees can both text or video a nurse practitioner on demand, live. So you can engage with your healthcare provider, you can get help, and if in-person care is needed, they will meet you in the office or at your home. So it's a very interesting care model, and Amazon continues to be very disruptive with what they're rolling out for healthcare. So a key takeaway from that is watch Amazon and how does it impact your business model if that type of care, if Amazon Care comes packaged with Prime membership for all their members. So we've got to watch what they're doing and ask how will that impact us? How are we iterating our business model? How are we evolving to be able to compete and be successful in this marketplace? So that's it for Healthcare Headlines. Thank you, Jordan, for your help. We'll be back next week. And please send us any questions, LinkedIn, Twitter, Facebook, call us, email us. If you email us, don't title it Coronavirus Update. We probably won't open it. But otherwise, we're here for you, and we look forward to talking to you next week. Thanks.